Hey everybody, my name is Megan Galloway, and today is video number 2 in a 3-part series on birth control. Now, if you'd like to follow along with this series, make sure you like this video and subscribe to my channel. Like the title of our video suggests, today we are going to be exploring birth control pills, birth control patches, and various forms of permanent sterilization. So let's start with the biggest subgroup of birth control, the pill. This was the original hormonal birth control on the market, and it was originally approved by the FDA as early as 1960. Since that time, pharmaceutical companies have modified and changed the pill tremendously to where we have a lot of options, hundreds of them on the market to choose from. Now, when I say the pill, most of us think of a combined oral contraceptive that has both ethinyl estradiol and some form of progesterone in it. Having been around for a long time, the pill is a crowd favorite. It has a lot of great attributes, like you only have to take a pill every day and poof, you're not pregnant. It's also non-invasive, which a lot of patients like. It's a known entity, people have heard about it for years, and it's usually something that people like to start out with before they end up going to other forms of birth control. The birth control pill is great because it controls a lot of our pesky period symptoms. It controls things like heavy bleeding, bad cramping, PMS, acne, and it's overall super safe and super effective. People don't like the pill because if you're like me, you have trouble taking a pill every day. I cannot remember to take a pill to save my life. I used to try birth control pills, but I had to stop using them because they just weren't effective for me. They also can come along with some side effects. So things like bloating, breast tenderness, occasionally breakthrough bleeding. Some people think that they gain weight on the pill, and so they're not for everybody. But for the vast majority of people, we actually can find a pill that works for most people's circumstances. The great thing about the pill is it's not one size fits all. There are so many combinations and doses of estrogen and progesterone out there that we can almost always find something that suits people's needs. As an example, when I was young and I was put on birth control pills for my horrific periods, I was put on one that's called a triphasic birth control pill. This pill in theory was genius because it was trying to mimic the natural ebbs and flows of estrogen and progesterone in our cycles. However, what it also did was make me super nauseous and make me gain a ton of weight. These days, most women are actually on what's called a monophasic pill. They found that if we keep the estrogen and progesterone really steady throughout the cycle, most women do a lot better and have a lot less side effects. So those triphasic pills are still out there and they still have their place. Don't go off of them if you love your triphasic pill and you want to continue on it, but just as an example, this is a way that we've changed birth control over the years that have helped women to control their periods and control the side effects. I'd love to go over a few examples of birth control pills out there that we've curated in order to meet women's needs better. The first one is called low estrin. It's affectionately known as LOLO, and it has only 10 micrograms of ethinyl estradiol in it, which is the lowest amount of estrogen in a birth control pill on the market. This is great for women who want a pill but want a really low dose of estrogen. The second of these is called Yaz. Yaz has been around for a long time, and we use it not only for period control and for contraception, but we also use it specifically to treat acne and PMDD, which is called premenstrual dysmorphic disorder, and that's another topic for another time. The third is called Seasonique. Seasonique is a 91-day cycled pill pack. What this does is help women skip their periods for 3 months at a time. They may have a period at the 3rd month, and while we can mostly skip periods with any birth control pill, Seasonique takes the guesswork out of it. Lastly, there's Nextstellis. Nextstellis is a fairly new birth control pill on the market, and it's formed from a newly discovered estrogen. This is a great option for people who've tried so many birth control pills and none of them have worked for them. So I usually put people on this pill if they're having a lot of side effects, but they really want to try to continue their pill regimen. These are just a few highlights, but if you're interested in the pill, make sure to talk to your healthcare provider about which pill might be right for you to control the things that you're you're looking to control. Speaking of the right pill, there are other pills on the market that are not what we normally consider the pill because they're progesterone-only pills. These are used for women who can't have estrogen for some reason. So for our women who are breastfeeding and can't have estrogen because it can decrease your milk supply, or for women who have, say, migraines with aura or have a history of blood clots, which are typically contraindications for women having estrogen. The most common progesterone-only pill on the market is called Micronor, and it's affectionately known as the mini pill. The mini pill is great. It is really effective, but you have to take it on time every day. If you miss it even by a couple of hours, sometimes it won't prevent you from getting pregnant. So if you are thinking about being on Micronor, you really need to make sure that you are going to take your pill on time every day. The second progesterone-only pill on the market is fairly new. It's called Slind. I love Slind because it meets all the goals I'm looking for in a progesterone-only pill. Slind not only helps to avoid estrogen, which is what some people need, but it also has a 24-hour missed pill window, so you have a little bit more grace in when you can take your pill each day. This is especially helpful for my new moms out there who have newborns, because newborns really make it hard to keep on a schedule. Unfortunately, some of the pills that we've just talked about are not well covered by insurance yet. But most of them do have manufacturer coupons, and some of these you can find online, and I'll insert the websites below in this video. But otherwise, you can always talk to your healthcare provider, and they can talk to their medication rep about potentially getting you a coupon if you're really interested in these specific pills. Okay, that covers the basics of the pill, so let's move on to the patch. There are only 2 patches that are readily available on the market. The first one has been around forever. It's called Ortho Evra, and the second one is fairly new. It's called Xulane. Patches have both estrogen and progesterone in them, and they're not used super frequently these days, but people like them because you don't have to think about them every day. Patches work by placing a patch on the skin every week, and then you take the patch off for the 4th week of the month in order to have a period. Now that's the on-label use. If I'm prescribing patches to people, most people are interested in being able to skip their periods. And so what you can do is use a patch once a week forever and not have your period. Most of the time, patches stay on really well, but some people who are in water frequently or who kind of sweat a lot have trouble with the patches falling off before the week is out. Patches do have more estrogen than most pills on the market, so while they can be a good option for birth control and they do a really good job at controlling heavy periods and heavy cramping, they oftentimes have a little bit more side effects than some of the pills do. This, I think, is why most patches are not used as much anymore, because people have better options at controlling their periods and preventing pregnancy without the side effects. Lastly, let's talk about permanent sterilization. Now, as a disclaimer, I am not a surgeon. I am also an expert in women's health, not in men's health. So while we will talk about things like tubal ligation, bilateral salpingectomy, and vasectomy, I do not perform these procedures myself, nor do I know a ton about vasectomy because I deal with women, not with men. Before we begin, I am going to give you the stern talking to that I give all of my patients who are considering permanent sterilization. If you are considering permanent sterilization, you need to be 200% certain you do not want any more children. You should always think of it as permanent and keep that word in mind. Don't think about it as, well, I'll get this done and maybe I can get it reversed later. Permanent sterilization is meant to be permanent. And so if you think you might want more children and you have sterilization, then sure, you can have an IVF pregnancy in the future, but why would you want to pay to have a baby when you could get pregnant for free? Okay, I will stop momming you and let's talk about our options. The first of which is called bilateral tubal ligation. This method effectively keeps the egg from traveling down the fallopian tube, getting into the uterus, and eventually becoming a pregnancy. It also keeps the sperm from going through the uterus to the fallopian tube and matching up with the egg. The procedure is performed by blocking, sometimes cutting, and sometimes tying the fallopian tube. Your uterus and your ovaries will remain intact. You will have normal periods afterwards, and you will not go into menopause, which is a question I commonly get. Sometimes tubal ligation can be reversed, but I wouldn't count on it. Number 2, bilateral salpingectomy. This is a procedure where the fallopian tubes are fully removed from inside the abdomen. The uterus and the ovaries still remain, and surgeons like this method because it reduces the risk of ovarian cancer by almost 80%. This method is not reversible because there are no tubes left to reattach. Lastly, we'll talk about vasectomy. One of the only times I'll talk about men's health in these videos is today, because a lot of my patients, when their families are complete, do want to discuss sterilization techniques, and they want to talk about whether it's more appropriate for the female to get the sterilization or the male to get the sterilization. Vasectomy is performed by effectively cutting off the sperm from getting into the semen. It does not stop the production of the sperm, but rather stops the sperm from getting into the semen. Now, I'll give you a word to the wise. Make sure if your partner is going to get a vasectomy that he goes to his follow-up appointment. Vasectomies are not 100% guarantee of sterilization, and if your partner does not go and give a semen sample after his vasectomy, he could actually not be sterile and you could get pregnant. Of note, vasectomy is a fairly minor procedure, and so when you're considering options for sterilization, a lot of families choose vasectomy because of the lesser risks involved and because of the lesser recovery time for their partners. There is a reversal procedure available for vasectomies. However, it is still not a guarantee, and if you're considering vasectomy, you should consider it permanent. I hope you have learned a little more about pills, patches, and permanent sterilization. We have one more video upcoming in this series, and if you want to follow along, remember to like this video and subscribe to my channel. If you have comments about any of your own experiences with these methods, or you have questions about them, please comment below. I'd be happy to respond. Otherwise, thanks for watching and stay healthy, everybody.